Chris, let me turn to you. You are on the front lines of palliative care. What do you see as some of the most difficult issues that you have to deal with and that you see others needing to deal with?
Yeah, I think one of the issues that are germane to the idea of death and dying, and the idea that we've got an armamentarium or the ability to impact that one way or the other, has to do with promises made. And I wonder if many of the technologies that we have end up being promises to patients and families that, in fact, an inevitable event is not going to occur.
Do you mean the promise or the hope that there will be a cure down the road?
Well, I think different than that. Let's take, for example, the session that you had on resuscitation last time, where you introduced the idea of new technologies that, in fact, make resuscitation successful, and you can restore individuals for time with their loved ones when you didn't expect them to survive. But here in New York City, if you look at success rates of resuscitation for on-the-street collapse, you are somewhere at about 1.8% for successful resuscitation. If you look at resuscitation in a hospital setting, even in a tertiary center, you're looking at resuscitation rates that probably peak out at about 30% for the entire population as a whole. I take care of cancer patients who are at the end stages of their illness, and if you look at success rates of resuscitation in that population, in a hospital setting, it's less than 5%. So when we talk about something like resuscitation, or we talk about something like new chemotherapeutic interventions, or we talk about new technologies in terms of surgical interventions, I think it's very, very important for us to be clear as a medical community what it is that we're offering, and then looking at those success rates and translating that information to both patients and families, so that what we're offering are not promises of success that are unrealistic and not borne out by the actual evidence of what these interventions have to offer patients and families, and then have the tough discussions about what are the benefits or what are the risks of the interventions that we're talking about people taking. You know, at end of life, the way I always look at it is you've got one chance to influence living. Because I've had a hard time understanding a good death. It's easy for me to understand what living is like before someone dies. And it's so important during that period of time to make sure we're meticulous and very careful about not only the choices we offer, but the information that we give, because it is such an important sacred time for patient and family.